Hello and welcome to the Washington State Board of Nursing's BONcast. I'm Carl Owen and I'd like to welcome you. I hope you enjoy learning about our state's Board of Nursing and specifically about the work we do to ensure the safety and well-being of the people in Washington State. It's estimated that 10 to 15% of nurses have a substance use disorder. That's a similar percentage as the general public. Undiagnosed and untreated, substance use disorder can result in legal issues, nursing license suspension, patient, public harm, and even death. Fortunately, there is help. The Washington Health Professional Services, or WHPS program, is the board's approved substance use monitoring program. WHPS, or WHPS as it's sometimes called, offers nurses with a substance use disorder an opportunity to safely provide patient care. That's done through the monitoring of nurses in a manner that safeguards the public throughout the stages of their recovery. WHPS protects the public by providing early identification, referral for treatment, and structured monitoring services. Today, we're fortunate to have as our guest Allison, who started her nursing career 29 years ago, first as an LPN and then an RN since 2003. She is a successful graduate of the WHPS program. She's worked in diverse and unique settings, from the NICU to correctional facilities and many others. Currently, she's the nursing manager at a medical detox facility, the same facility she entered in 2019 for alcohol detox. After 12 years of struggling with severe alcohol addiction, losing 2 jobs for being intoxicated at work, and ultimately faced with losing her nursing license, Allison surrendered and began the fight for recovery and long-term sobriety. With significant help and support from the WHPS program, she's been sober since April 7th, 2019. Allison says her passion is to share her story with nurses who live in the shame and self-loathing of active addiction and are terrified to ask for help due to fear of losing their license. She's experienced the same fear and shame firsthand and knows there is a way out. Welcome, Allison. Thanks for being here.
Thanks for having me. I'm happy to be here.
Great. Can you give us a brief history, your background, and just how you got here?
Well, I am originally from Southern California. Where I was born and raised. And I became a nurse, as you said, as an LPN first. And how I arrived at nursing was my mother had ALS. She was diagnosed right before I went into high school, and I helped care for her until she passed away. And at that point, I didn't know where I fit in the world, and I didn't know what I was going to do with my life. And nursing just seemed kind of like a natural choice because it was familiar, and I knew I'd always have a job, but it certainly wasn't something that I would have called a calling. And so that's how I entered nursing. And I grew up in an environment too where alcohol was readily available. It was very normal. My parents always had a drink at night. They had happy hours at our house. My dad built a bar. So alcohol just seemed like what every family or everybody did and drink. And I mean, which is essentially true. So it was never something that I thought would be something to be afraid of. And I also come from a family with significant substance disorder issues, and it was, it was a genetic thing as well for me. I can look back now, and I also grew up with some significant childhood trauma. And the thing I think that affects this particular part of my story is that my mom was super controlling of food to this crazy extreme that I developed behaviors that would later to get food that would later manifest my hiding alcohol. So there was just all of this kind of perfect storm building to lead me into where I'm at now. I think the biggest catalyst for me was having gastric bypass surgery. I had that 20 years ago. And prior to that, I hadn't really been drinking a lot. I drank pretty much like kids in high school. and that sort of thing. I never drank for the taste. It was always for the effect. But I had a long period I wasn't drinking. And once I had that surgery, I think I went almost a year and never had a drink. And that first drink was what set everything in motion to get me here now. So quickly escalated. At the time, I was living in Arizona. And by 2012, I was in my very first treatment. I knew I was in trouble and I sought out that help. But it's obvious now that I wasn't really ready to do what I needed to do. I just wasn't ready to give up that coping mechanism. And so it just progressively got worse. And then I ended up moving to Washington in 2015, and that's really where my story begins.
So, how quickly and why did your substance use escalate when you moved to Washington?
So I think it's a number of things. I had an extended period of sobriety in 2015 and 2014, and I started drinking again about 2 months before I moved to Washington in October of 2015. And when I stopped, as soon as I picked up again, it was like I had never stopped. And so when I came up here, I was already in that cycle. And moving my whole entire life up to from basically as close to the Mexican border as we are now, I am to the Canadian border, and not having a support system. I had a couple friends up here, and that was it. And it was just me and my husband. It made a huge impact on me. I didn't have the connections that I had, those in-person connections that I had down in Arizona, especially when I was involved with AA. I just didn't have that anymore. And I was just so blind to the fact that I really needed that if I was going to stay sober. So drinking just became what I did when I wasn't working. And it kept me from building, another part of my life anyway.
So, you were aware that it was escalating, and it sounds like you were in kind of a vulnerable spot. What did you try to do to repair it at this point?
I knew I had an issue in Arizona. I didn't know how bad it was until I got up here. And when I realized that, and I realized how much I was putting things in my life at risk, from my nursing license to my marriage to work, knowing that it could get to work, I did what I thought I could do, like everything I believed I could do to stop. And I just failed over and over again. I was involved in AA, would be sober for a while, and then would drink again, and then would be so embarrassed I wouldn't go back. It got to the point where I was drinking probably close to a fifth of hard alcohol a day, and somehow I was still making it to work under the influence, but I certainly wasn't able to meet my job expectations.
So, Allison, when did it truly escalate to where you were drinking at work? And why did that happen, do you think?
It got really bad, and I knew I had to do something in 2017. And so I went into treatment again voluntarily. But I didn't have that support system when I came out. I didn't have anything in place. And so I was drinking again. And by 2018, I started drinking at work. And it wasn't often, but it was obvious. I obviously knew that I was getting to a point of no return. And the more I drank and the more I got away with it, so to speak, the bolder I got. And the more I was able to drink during the day, the less pain I had to feel, the less of the self-loathing, the less it just numbed all of that out. And then I just continued to find ways to do it, believing that nobody would know. And obviously, the worse it got, it became obvious. And my body, towards the end, my body was so dependent on the alcohol. I couldn't function without it. I had to have a constant level in my blood, or else I would be going through significant withdrawals. And I knew I was in trouble, and I tried really hard to try to find a way out without having to tell anybody. I voluntarily put a breathalyzer in my car, thinking that would help. And I figured out a way around that too. So it wasn't like I wasn't trying. I was seeing a counselor, but I did not know what to do.
Allison, how were you able to hide this from your coworkers for so long?
What I would use vitamin water. I would dump out that vitamin water that like a pink, and I would leave a little bit in, and then I would pour vodka into that. And so it looked like I was drinking something, like actually drinking what should have been in there. And I wasn't drinking right in front of people, but if it was out, then there wasn't any suspicion. I also did my best to keep my distance from coworkers and be as far away as I could from patients. I did the chew gum, I tried to eat things. I did everything I could to not to be detected. And it worked for a long time until it didn't work.
So, what ultimately pushed you to where you sought help?
It was being fired from my job for being intoxicated at work, but it wasn't my first time being fired for that. The year before, I'd also been let go from a job. And what I will tell you, and what I think is the best example of the insanity of addiction, regardless of what the substance is where I found myself in that first job that I was fired from. I worked in a county jail, and I would drink while I was at work on the night shift. I had the breathalyzer in my car still. And if I was drinking at night, I obviously couldn't start my car in the morning. And so I would have to sleep in the jail parking lot. And over 3 months, it was again insanity where I didn't have enough alcohol to get me through the shift. So I would take an Uber and go get alcohol before the stores closed and come back. And when I say that now, I'm horribly ashamed about it, embarrassed, but I put it out there to give an example of this insanity, and I couldn't stop. So I did get fired from that job. I got the very last job, and it continued. And what ended up happening was I ended up in a blackout while I was in the office, and I couldn't hide it anymore. From that point on, I was let go, and I knew from previous experience in Arizona that because I was convinced I was going to lose my license, but I knew that if I self-reported to the board that I had this going on and that I had been caught essentially, that was going to be a lot better when I was actually reported. So that's when I started. That's where it all started for me, the WHPS journey.
So, you reached a point where you knew you had to self-report essentially.
Yeah, if I didn't do it, I mean, it was going to be reported anyway. There was filed, and as it should have been, as it absolutely should have been. And so, in order to kind of get ahead of that, because at that point, this hell that I was living in my life, that I was an alcoholic, so that made it worse. I was in the hospital the first night after it was discovered I was intoxicated at work. The next day, I came home and looked up on the website what the program, which the monitoring program would be. And I had no idea what the name was or anything, but I found it. And I reached out and I did my intake assessment with Dr. Furman, who used to be there. And he was amazing. He was compassionate. There was no judgment. I could tell he really wanted to help me. He wanted me to succeed. And he gave me all the rundown of what I would need to do to start the process. And when I hung up, I actually had some hope finally.
So, you talked to Dr. Furman and you felt a little bit better about that. And then, so what were the next steps of getting the help and getting through the WHPS program?
So it was a journey of 1,000 steps to get to where I am now. And 2 days later, I lost my insurance. So I had to have a substance use assessment to determine by a counselor what my plan of care would be, and this would come back to WHPS and what their recommendation was. And the recommendation was that I go into inpatient treatment, which I wholeheartedly agreed with. However, in doing that and agreeing to that, I had to figure out a way to get there. And as a nurse with a good income and no insurance, I wasn't sure. I was at a loss of what to do next. So for the next month, I continued to drink, partly because in order to stop, I'd have to go through some sort of detox. And the other way, mostly because I didn't know what else to do. I looked into other avenues. I looked online with the state to see if I could get insurance. And it wasn't until the very end of that month following when I started that I found out on a Friday going 30 days without a paycheck qualified me for state insurance. Saturday, I called our local detox to see if they had a bed. And that night I went to our ER and was cleared medically to come into detox. And so that's where it really all started. Now, I just went in, I did whatever I could to get myself in the door, but it was all the stuff that came after that once I did get sober, which was really hard. The detox process for alcohol withdrawal is really hard. And it was so helpful to have the resources that I did in detox. They were able to get me set up and found a treatment facility for me. I was established with insurance. And when I was done and it was safe to leave, they drove me to the bus station, put me on the bus and stayed there till it drove away. And I went to treatment. And not having to worry about that was such a relief. And I think that so many nurses and people in general don't know of these sort of services that can just alleviate all that worry at the beginning.
So what did you do after the inpatient treatment was completed?
So because I had established with WHPS in the loop about this beginning process, I had been a case manager, and she actually came to the facility where I was at and had me sign the WHPS contract then. So I was already a part of WHPS before I was actually discharged, which was super helpful because I already came out with this built-in accountability and a way to navigate life in relation to my career. So I got out immediately. I started with the WHPS nurse peer support group, and we met once a week, and it was right before COVID hit. So we were actually meeting in person. I finally felt understood because I was with a group of people of my peers who were also going through the same emotional difficulties as I was. You weren't the worst person in the whole world, because that's certainly what I thought, and the nurses I know also thought that was just so comforting. And so that right away made a huge difference for me. At the time, I wasn't working yet. I had this mantra while I was in treatment that was the right job will come at the right time. And that's what ended up happening for me. Within 3 months of coming out of treatment, I was hired in a long-term treatment facility just as a floor nurse, which was really helpful to me because I was in a situation with patients that I understood at a level that only somebody who's been in that situation can empathize. And I couldn't share that with them, but it just filled a part of me. And so I was supported. They worked with WHPS. There was never a problem. And I continued to just do what was asked of me in WHPS and what was required of me. I did my accountability level of being called to do UAs twice a month or blood. And that kept me on the straight and narrow because I knew if I drank or did anything, it was going to show up in that. There was just no way around that. So that was huge for me. And I got into this routine of WHPS, and it just became a part of my life. And it was hard. I will not lie to anybody. It was very difficult. It was a huge adjustment. Sometimes it felt suffocating, but it isn't until now that I'm on the other side, do I understand how valuable and important it was to getting to this place of sobriety, of long-term sobriety.
And Allison, you've told me that, a motivation of yours, a passion, in fact, you said, is helping others. So what would you say to those out there, whether they're nurses or not, who know they need help, but they're intimidated or ashamed or having trouble making that first step?
I think what I would say to anybody who is suffering an active addiction is that there is a way out. There is a way out for everybody. I will never be the person that says, if I can do it, you can do it, because we all have different circumstances. I had circumstances that actually helped me in the end to get to where I am now that other people don't have. With that, I will still say that it is possible. It's absolutely possible to pull yourself out of the hell. As far as nurses, this is where my heart is, because I understand it so much. I understand the shame. I understand the self-loathing. I understand the hopelessness, the helplessness, the fear. I get all of it. We all have our poison of choice. And what I will tell you is that while you believe you're suffering alone, that there is nobody who is as terrible as you are, somebody else is suffering just like you are. And we're doing it in silence. I did it in silence. And the more I hid, the worse it got. And I didn't believe that I was ever going to be able to come back. And as a nurses, it's so much of our identity, and we're so trusted. Our profession is so trusted. To actually come out and say that you have this problem is just soul wrenching. And it's still, no matter how hard it is, it's going to be so much better if you don't let it get to the point that I did, or where most of us do, who end up before the board or in the WHPS program. You can stop it before you get there. It isn't worth getting to where I got to. If I could do it over again, knowing what I know now, I would have 100% been much more proactive with it. So, when you get it, I don't like using the term get caught, but essentially that's what happens. The majority of us end up in the WHPS program because we were caught. I was under the influence of alcohol. Many nurses are caught diverting meds. And with diverting narcotics, you're really putting yourself at risk for law issues, being arrested, the DEA getting involved, which just completely it makes it 1,000 times worse. And you can keep that from happening. Maintain your license, have anonymity with it, get help, and not have to deal with all of that blowing up your life when you could very well lose your license in that particular area as far as diverting meds. And having the WHPS program, I will never say WHPS saved my life, because I saved my life with a lot of help. The farther out I get from graduation, the more I realize how important it was to getting where I am now. It's not perfect, but what I will say is those involved in running the program are absolutely open to making it better. The program is not punitive, even though it feels like it. I know that everybody that I've dealt with in the program cared so much about my success. They had to hold me accountable because that's part of it, but everybody wanted me to succeed, and I felt a lot of encouragement. So I think that figuring out the process to get yourself from active addiction and getting through that point is detox, and finding a facility like where I work is super important, super helpful. Knowing ahead of time that having substance use disorder and going into treatment is a medical situation, and you will qualify for FMLA. You will also qualify for the state paid leave, and that is a significant help when you are afraid that you're not going to have any income. If you don't have insurance, like I went 30 days, you can qualify for insurance. I had that until I started working again. The program, there's legislation that's been passed for a stipend to be provided to those nurses coming into the WHPS program to help offset the costs in the beginning. And so what seems impossible is absolutely possible. Everything that comes up, like, I don't have the money, I won't get paid, all of that stuff, those particular things, to have those taken care of, to know that those will be taken care of, allows you to focus in on what you need to take care of. And so having all that information is so important. And going into WHPS ahead of time and knowing it's a tool and that you're not in trouble per se is something I think is considered by every nurse in the situation I was in.
So, Allison, we're coming up on the end of the podcast. Is there any thing else that you would like to let people know?
I really want to say again that the hell you're living in, you can get out. There is a way out. There's a way out for everybody. But you have to take that first step. And I hope everybody takes that step.
Well, thanks a lot, Allison. It was really good to hear your story, and we really appreciate you being with us today.
Thank you.
If you're a practicing nurse and you're looking for help with substance use, you can call the WHPS program at 360-236-2880, option 1. Or feel free to browse our website at nursing.wa.gov. Click on the Support for Practicing Nurses tab, and then Support for Substance Use, and you will find more information about the program. Well, that's it for today. On behalf of Washington State's Board of Nursing, thank you for listening to our BONcast. Be on the lookout for future episodes.